Hi everyone. This is our brief overview of what the periodontium comprises of and what healthy tissue should look like. So this is my model and this is my cute pointy finger. Hopefully you laughed. So now you'll pay attention. Now, to serious information. Let's first start with the word periodontium. Periodontium does come from the word, it's actually a Greek word. Peri means around, and odontus comes from the Greek word tooth. So we're discussing what's around the tooth. So let's get rid of the tooth so we can look further. There's four tissues of the periodontium. They are the gingiva. This is the gingiva, the cementum, the periodontal ligament, and the alveolar bone. The gingiva, when it's healthy, should be light pink in color, firm, and sometimes there's some stippling, which is kind of like a slightly bumpy texture, kind of like an orange peel would have. And just so you know, if anyone does have a darker complexion of skin, they may have a darker color of the gum tissues, and that is normal and healthy. The gingiva itself is divided in 4 anatomical areas, and I want you to look at your textbook, Foundations of Periodontics for the Dental Hygienist. Page 6 has a really great diagram, so please, please, please look at that. The gingiva in these 4 anatomical areas, the free gingiva at the top here, which goes from the gingival margin to the attached gingiva. Then you have the gingival sulcus, which is the natural space where our dental floss fits into. And we're going to use our periodontal probe on our patients soon. So get ready for that for clinic. And then we have the interdental gingiva, that fills the interdental embrasure between 2 adjacent teeth, and the attached gingiva that is tightly connected to the cementum on the cervical third of the tooth. The cementum, though, let me go back to my model. The cementum is the actual coating on the root surface, only on the root. And that's kind of a little light yellow color, and it's softer than dentin or enamel. It is a bone-like tissue that is more resistant to resorption than bone. And cementum does not have its own blood supply or nutrient supply. So it receives its nutrient from actually the periodontal ligament. And the periodontal ligament is actually a fiber that is soft connective tissue that covers the root of the tooth, that attaches it to the bone and the root of the tooth. So it's actually a very thin spot right in there. The fibers of the periodontal ligament attach to one side of the root cementum and to the other side of the alveolar bone in the tooth socket. It supports the tooth by suspending it and giving it a cushion effect so we can chew and eat. And last but not least, the alveolar bone, which is this kind of peachy pink color that surrounds the whole root of the tooth, is the bone that actually holds the tooth in place. And it surrounds both the upper and lower jaw and supports the tooth in place. The alveolar bone forms the bone socket that provides support and protection for the roots of the teeth. So thanks for listening for my little brief summary and looking at my model. Please read the chapter 1 and 2 from your wonderful textbook, Foundations of Periodontics for Dental Hygienist, for more detailed information. Take care for now. Bye.